Are we trying to cap it? Well, it failed on party line. Why did it fail? Because the intent of this legislation is not to make sure that everybody has insurance, but to make sure that everybody is in the government program. Not just the 50 million, all Americans. And for this reason, in this legislation, it tells you that if you have your own health care, you can keep it. That's what the president says. But don't make a change. If you make a change in your insurance, you lose it. And you have to go then to what they call the exchange and get a government option for your insurance. So if you have insurance you like, let's say you have prenatal care and you turn 45 and you decide you don't want prenatal care in your insurance anymore. So you want to cut that out, you can't do that under this plan. If you do, then you have to move towards, you have to join the government option program. Same with your business. If you have a business and you provide insurance, you could keep that insurance until your business decides to make a change. If they make a change in their insurance, then they have to go back to this exchange and then buy a government product. And that's what will be provided to you, is what they deem is necessary for the American people. So, having said all that, I want to raise some questions, but I think there's a couple of other points that need to be made. And that is, most of us in Washington, D.C., including myself, want to see healthcare reform. I want a bill that provides more competition, higher quality, and less cost. And I think most everybody here in this room agrees with that. But without tort reform, without the ability to buy your insurance over state lines, keep in mind that your insurance policy is limited only to the state of Nevada. You can't buy your health insurance in California or Idaho or Utah or Arizona. You can buy your car insurance anywhere you want. You can buy your life insurance anywhere you want. You can buy your car insurance from that lizard. I don't know who here has Glasgow, but that's out of Maryland. You're actually buying your car insurance out of Maryland. You can do that with your car insurance. You can do that with your life insurance, but you cannot do it with your health insurance. And so there's less competition. There's some 1,300 insurance companies out there. I think there's a lot of them out there that would love to have your business, but they're forbidden to do business with you because they're located in another state. We ought to open this up. There ought to be more competition. There ought to be lower costs, and I think everybody expects better services. That's what we want out of reform. And I'm not certain that this particular plan meets the more, higher, less, more competition, higher quality, less cost. So having said that, maybe there's others that have ideas. Come on up to the mic if you have questions or comments. And I'm eager to learn what your concerns and what you have to say on health care.
Yes. Hey, I'm Rich Lexington. I live right here in Reno, and I was watching the news at 6:30 and heard about this actually came down.
I'm glad you did.
Hey, one comment, two questions. One comment, we watched our Senator Hansen in a 30-minute press conference explaining his zipper problem. But I've never seen him come up and do a 30-minute press conference that doesn't get it. That's just a comment. But you see him, tell him, spend some time with people. We don't care what he does in his office. First question. You hit it a little bit. You have 50 million people supposed to. I've heard this 50 million back and forth, back and forth. I've heard there's 12 million in illegals included. There's 12 million people who got money and they can buy it anywhere, and then you got the invincible young people who don't care yet. So what? And I'm going to get to the second question. You can answer this all at the same time. I want to know what the real breakdown of this 50 million is, and what are we spending on? In reality, we're spending whatever this $1.5 trillion plus on how many people? That's the first question. And the breakdown. The second question, I'm on Medicare, I'm on Social Security. They're telling me, or in one of these things, they're going to save $500 billion out of Medicare. They're telling us Medicare is going to go broke in 8 years. If you can find $500 billion savings in Medicare on a program that's still going to go out of business, why don't you leave the money there instead of setting up a new program on our backs?
There you go.
On the first question, on the first question about how many are there. And yeah, that's the number that we hear. And I don't know the breakdown, but the numbers, and that's why I wanted the census to determine that. The census would determine who are eligible, who should be receiving, who does not, and has not received insurance at this point. We do need more information about it, because all the subsets you were talking about, whether they were legal or illegal, whether they want insurance or don't want insurance, or whether they would rather buy an iPod than have insurance, there are Americans that choose that. And so should you be required, the rest of you in this room, to provide insurance for those who have other priorities? And I think that's a question that is well thought out, but I don't know the answer to that. What was the second question?
Second question is, why are you going to take
Medicare, correct, I got it. Yeah, the plan in here is to take $500 billion out of Medicare. $500 million, so any of you that are on Medicare today, they're going to take $500 billion out of Medicare and give that health care to somebody else. That's the plan. That's in this plan somewhere. If you can find it, let me know. To somebody else. Medicare is on the brink of bankruptcy, as is Medicaid and Social Security. 3 areas that are very difficult. But what bothers me the most are the doctors' reimbursement rates. They have reimbursement at 80% right now with Medicare, and we're going to say we're going to take $500 billion out of that and give that to somebody else, and yet we have doctors out there that are struggling. And what good is Medicare if there aren't doctors that are willing to take it?
There's a lot that won't take it.
There's a lot that won't take it because the reimbursement rates are so low. And so that has to be fixed. And taking $500 billion out of Medicare will not solve that problem. Yes.
Hi, Dean. Being 73 years old, I'll tell you what, this is the first time in my life that I'm afraid of my own government. Now, I paid into Medicare for about 40 years. I paid into AT&T, the medical plan, for 35 plus years. And now I understand that with this stupid bill that we've got here, is that they want to us to pay income tax on imputed income. And that would be the value of what the company is paying for that health insurance. And I don't know if you have that answer tonight or not.
Yeah, I don't, but I think every small businessman in here needs to understand what this plan means to them. Under this administration, with the budget that was passed, your tax rates, marginal rates will go up 5%. That's just in the budget itself. Then when you get to this particular piece of legislation, there is another 5.25% payroll tax on top of the 5% that's already passed and signed by the president. So you got a 5.25% surtax. And then as an insurance, as a small business, if you don't provide insurance, there's another 8% payroll tax on top of that. So in a span of 8 months, we're talking 18.25% tax increase for some small businessman or woman in this state, in this country, in these economic times. Can someone please explain to me why that makes sense? So your point is well made, in that I am as concerned for the ability of small businesses to expand. Your fear of your government today, and there are people on your side. Let me assure you, there are people on your side. And there's a good core of representatives. And I know it's difficult, but let me assure you, I understand where you're coming from and what your concerns and fears are. You paid into Medicare, you paid into Social Security, and there is a fear that at some point government is going to decide what kind of health care that you eventually get. Now, there's some fear out there being discussed that there will be caps on the type of health care that you can receive. And I don't see it, and let me tell you, the rhetoric, it's understandable that you're as concerned as you are. If they're saying they're trying to cut costs in health care, 70% of health care costs are for people, are spent on people over the age of 70. So if you're going to make substantial cuts in the cost of health care, Who is it gonna affect?